Okay. And one more piece of housekeeping before I pass it on to Catherine. There's a place at the bottom of your screen. You may be familiar. It says Q&A. That is a place to put any questions that you might have that might come up during the course of the webinar. And the questions will get answered at the end during the Q&A period. All right, Catherine.
Perfect. Thank you so very much. First and foremost, I want to thank everybody who is joining live today and those of you who have registered and will be watching this recording. This is the kickoff to a series of monthly events that we'll be hosting. And really appreciate everyone's time because I know how busy most of your clinics are. So I wanted to just share with you a little bit about where this all kind of started from before I introduce to you Alexander Mostovoy. So this all started with a conversation with Alex early summer, I want to say June timeframe-ish maybe. And the need arose because of the fact that I talked to so many different physicians with different backgrounds, practitioners, chiropractors, osteopaths, acupuncturists, sports medicine, etc. And I mentioned it to Alex and I said, it would be great if we had a series where we can start educating and sharing information about thermography so that when our clients show up in your clinics with their thermography scans, you know exactly what it is. But in addition to that, it's really important to also have an additional tool that you may be interested in to add to your process already, to share with you an additional tool that you can use to help support your clients in a different way. So that's where this is all kind of came from. And so we're very open to additional feedback and what is going to help to continue to support you in the field and helping your clients and your patients with next level support and help for their health and well-being. So thank you. So with that, I have the absolute honor and pleasure today to introduce to you Alexander Mostovoy. He is a distinguished clinician, author, and researcher. He's acknowledged for his unparalleled contributions to breast health, cancer prevention, and clinical thermography. With over 20 years of experience in homeopathic medicine, he has been exclusively focusing on medical thermography since 2016. He has also successfully shared his expertise, providing lectures across Canada, the US, South America, and Europe, training numerous professionals on breast cancer prevention and thermographic techniques. Among his many accomplishments, Alexander is the best-selling author of Breast Cancer is a Preventable Disease and was instrumental in orchestrating the 2016 Breast Cancer Prevention Global Virtual Conference, which garnered attention from over 5,000 international participants. Professionally, he has pioneered and directed an integrative health clinic in Toronto, where he introduced the innovative breast thermography method. As the visionary founder and CEO of Thermography Clinic, Inc., he expanded the venture to over 30 global locations, serving more than 60,000 women. Dr. Mostovoy, a Homeopathic College of Canada alumnus with a doctorate in homeopathic medicine and science, is among the few board-certified clinical thermographers in North America. His affiliations include his current presidency at the Canadian Association of Clinical Thermography, as well as holding esteemed positions in various homeopathic associations. His voice has echoed through multiple television and radio appearances, and his insights have been published in numerous health periodicals, showcasing his dedication to the field and the well-being of patients worldwide. It is my great honor and pleasure to pass this over to Dr. Mostovoy. He is also the support that is behind Thermography Clinic New Brunswick, and I am absolutely, again, honored that I get to work with such a brilliant man. So Dr. Mostovoy, I'll pass it over to you.
Thank you, Catherine. Much appreciated. Kind introduction. And I want to welcome everyone. I see participants are still joining us, so I want to welcome everyone who decided to join us. As Catherine has mentioned, we are going to be doing this on a monthly basis. And today is just going to be introduction to thermography from kind of practitioner's point of view. Anyway, I just wanted to kind of kick this off with maybe a little joke, just to get everyone relaxed and in a good mood. Not sure if you had enough coffee this morning, or maybe you're missing lunch, but smiles always work. So I came across something that I found curious. This was this elderly couple. The gentleman was 98 and his wife were 96. And they have been married together for 75 years, believe it or not. And someone asked them, how is it that you guys are, first of all, staying married for such a long time? And you both look so healthy and you look so vibrant. So they mentioned that just a little while after they got married, 75 years ago, they made a pact with each other that every time they would have an argument, the one who loses the argument has to run 5 miles. So the gentleman naturally is running every day 5 miles. And they say, well, okay, that explains why you look so young and slim. What about your wife? She looks even better than you. He says, well, she runs along with me, making sure that I do run 5 miles every day. So without further ado, let's just start with maybe why we're here anyway. I mean, if you're interested next time, I'll prepare a whole collection of jokes specifically about health practitioners, but I'm sure we'll leave that for special requests. So, as I mentioned, this is brought to you by Canadian Association of Clinical Thermography, and this is specifically series for health practitioners. However, we may have people who are not necessarily in health practice. You're welcome to. Let me introduce something right away with an image. Okay, so first of all, what is thermography? Thermography, or some of us are used to calling it infrared thermal imaging. It's a non-invasive diagnostic technique that allows the examiner to visualize and quantify changes in skin surface temperature. So on your right, you will see a very typical thermal image. On the right side of the image, you will see a scale, a color scale. The numbers are representative of degrees in Celsius. So in this particular case, it comes from 26 degrees to 36 degrees Celsius. And the color scale is as follows: that, for instance, if you're looking here at blue patches here and here, that's going to be corresponding to about 29 degrees Celsius. If you're looking at yellow, that's going to be 33, and then reds are going to be 34, 35. So naturally, you will see the same thing, or I shouldn't say the same thing, you'll see something similar just visually looking at this young man. You will see that his right shoulder is significantly dropping compared to his left shoulder. Now, why is that? When we see something like this, I immediately think, why is this person standing this way? I mean, he's physically well-developed. Well, he's standing this way because he is compensating for something. So all of this comes down to this little spot where I put kind of a red arrow. Why he's compensating and standing this way is because this little spot right there. Everything else is fairly symmetrical. He does have a little bit of heat and maybe muscle tension in the upper trapezium, but the reason he's standing this way is because of this little spot that happens to be asymmetrical and unilateral. We'll come back to this later on in the presentation, maybe not exactly to this image, but you'll start to understand how thermography can visualize, in a sense, something that you cannot see with the naked eye. So why is it relevant? Because thermography basically is, the main idea is detecting early. I mean, I'm not going to persuade anyone that early detection definitely saves lives. That's a well-known fact. But one of the primary utilities of thermography is its potential for, as I said, early detection. Now, thermography is very sensitive, and it can identify minor temperature variations. And these variations may indicate inflammation or variation of blood flow. And sometimes you may see a particular picture, if you wish, even before the symptoms develop, and or maybe even detectable by other conventional methods. So it offers more of a comprehensive view of the body's condition. So instead of focusing on singular aspect, thermography provides a broader perspective and really is indispensable and invaluable tool that allows us to identify the root cause and not just the symptoms. I use this particular illustration. I'm sure that many of you know about the story of blind men kind of assessing the elephant. And so it depends on their perspective and depends on their position. One of them is saying that, well, you know, an elephant, it's a wall. And that's true. Or the other one who is looking at the trunk of an elephant, well, an elephant is definitely a tree. Or maybe, maybe it's a spear, or maybe it's a fan. And definitely if you're holding off to the elephant's tail, it is a rope. And that's what I find is missing in today's medicine, because we have so much specialization and everybody is looking from their point of view that we're really sometimes missing a big picture. As a matter of fact, I came across a very interesting story years ago where a professor at medical school in Texas would bring their medical students to an art gallery. And yes, it's not necessarily looking at mummified expositions, but looking at pictures. And he would ask his medical students, what exactly do you see? And someone would say, well, I love the paint, and I love the colors, and I love the composition, and I love this and that. And he says, no. You have to look at the whole picture. In other words, a holistic point of view is kind of probably the most important thing of looking at a patient as a whole. So remember that patient safety and comfort is also very, very important. So unlike some imaging modalities, thermography is non-invasive. There is no contact. There is no ionizing radiation, which comes from X-rays. And it's making it a safer choice for many applications, particularly when it comes to frequent imaging that may be required. Listen, just like everybody else, I love CT scans, but I wouldn't want to have CT scan one after another, unless there is no other choice, and unless, let's say it's an emergency situation. We all know that X-ray radiation is cumulative. In other words, after 5 or 6 or 7 cumulative CT scans, we're most likely to develop malignancy and pathology based on the test itself. In other words, the more you have, the more likely you're going to develop some kind of problems. That's where thermography comes in, because it's completely non-invasive. And not only that, I always joke around with our patients saying, for a change, you're actually radiating us. So, why should practitioners look at thermography? Because it's a complementary diagnostic tool. In many cases, it will fit exactly in that puzzle of other complementary kind of modalities and tests, and something is missing. And all of a sudden, just like with that first initial image that I've shown you, why this young man is leaning to his right is because of that red little spot just on the side of his lower back. Okay. This is something that you may miss unless you have additional information. So in an ever-evolving world of medicine, I think we all need to kind of stay ahead of latest technologies, and it will ensure that we're using the best possible technical information for our patients' care. And by incorporating thermography, practitioners signal that they are really committed to leveraging all available tools for the patient's benefit. Another thing that I wanted to mention is that thermography provides really diverse applications. What do I mean by that? You can detect inflammation, you can evaluate vascular conditions, you can assess pain, you can even use it in dental health or physiotherapy. And so the applications are vast. So for a diverse practitioner, and that's what I mean by kind of a holistic point of view, this means that a single tool can serve multiple purposes. And one thing over the years, and I've been doing this now close to 25 years, I realized that full body thermography is really a holistic point of view of looking at different things. Now, some of them may be already symptomatic, some of them will become symptomatic, and some of them may never become symptomatic because of early kind of intervention. But you're looking at a picture as a whole, and we'll kind of get into a little bit more detail later on in this presentation. I also want to kind of emphasize that we're not going to be detailed with specific things, let's say breast or orofacial thermography, that we're going to leave for later presentations. Each and every month we'll have something specific, but this, as I said, is just an introduction to basics of thermography. So what I really love about empowerment, and maybe because I'm also kind of visually oriented, is that the patient empowerment. When the patients can see their conditions, it will definitely lead to better compliance, of course, with treatment as well. In this particular case, you are looking at hands, and some of the fingers are so cold, we will call them kind of thermally amputated. I can assure you that the fingers are there, but that is very, very common with people with Raynaud's disease. So we're not relying on practitioners' word. We can see the evidence of the issue, okay? Obviously, people with Raynaud's may already have the symptoms, especially in cases like that. So, but I just wanted to illustrate how thermography kind of gives your patient a visual understanding exactly what's going on. So there are some conditions that will require frequent monitoring. For instance, non-invasive and radiation-free nature of thermography makes it an optimal choice. So it's safe for any kind of frequent monitoring, as I've mentioned before. So in conclusion, thermography is a tool with significant potential. Technology will continue to advance, healthcare will continue to advance, and the way I see that healthcare advances more and more in terms of individual healthcare. The conveyor belt healthcare is basically broken, and you know, we can become more attuned in terms of early detection, and of course, everyone here, I'm sure, agrees that prevention is definitely the key, and tools like thermography are more likely to play even as a prominent role in this whole kind of equation. Sorry. Okay, here we go. So let's go back And for those of you who are new or just not sure exactly how things work, because I always like to kind of figure out how do things work after all. So what is thermography after all? It's a diagnostic imaging technique that visualizes and measures changes in the skin's surface temperature. That's about it, okay? As simple as that. However, how does it work? Thermography camera detects radiation in the infrared range of the electromagnetic spectrum, okay? I didn't want to get into the whole issue of the electromagnetic spectrum, but it's common in any, I think, grade 11 physics, so the heat comes off the body, which is naturally produced, and the images, the camera is basically capturing these images based on that radiation, okay? So the science behind this, again, it's fairly simple. Every organ in the body has its unique thermal pattern. There are some even portions of the body that have a unique thermal pattern that is considered to be within the normal range. Now, any abnormalities, such as inflammation or reduced blood flow, can be reflected as temperature changes, which is quite natural. And this is something that I want you to kind of take a look, because once you get this, you'll get kind of most of what we're talking about. I'm sure everyone is familiar with Celsius scale and Fahrenheit scale. So it depends, all right? But these scales are not absolute, they're relative. And they're all actually relative to Kelvin scale. So Lord Kelvin kind of discovered this, and as you can see, he was kind of living at the height of Industrial Revolution. He discovered one simple thing, that there is absolute zero. The zero is the temperature where molecular motion ceases. So in other words, there's no more heat. It's the bottom. It's minus 273 degrees Celsius, which is very, very, very cold. And, you know, anytime I give kind of similar presentations south of the border in the America, in the United States, I always joke about this, that this is kind of minus 273 degrees Celsius is our average spring temperature in Canada. So all objects with temperature above that absolute zero will emit infrared radiation due to motion of their atoms and molecules. So the warmer the object, the more infrared radiation it's going to emit. How does it work? So now we have thermal cameras that will detect this infrared radiation. Regular cameras, including your eyes, will see things because it all depends on visible light. We're not dealing with visible light. We're dealing with heat energy that's being emitted. So that's kind of a slightly different thing here. And when you see, finally, when you see an image that you've seen just a couple of minutes ago, it's called color representation. In other words, once detected, the imaging software will assign a different color, or it could be shades to different temperatures. Usually, warmer colors or warmer objects might be represented with colors that are like red or white. And finally, cooler objects might be shown in blue or black, okay? So once you get this concept, as I said, basically you understand how the whole thing works. Let me put this together from a perspective of clinical practice. How do we interpret thermographic images? And I'll give you three basic laws or three basic kind of concepts. Of course, there's a little bit more than just three basic concepts, but these are crucial. So first of all, we're going to be dealing with hot and cold. We're going to be dealing with symmetry, right? Symmetry is key, comparing left to right. just like in this particular case, we have two sides to the face, we have two eyes, we have two ears, we have two shoulders, we have two legs, two arms, and so on and so forth. Symmetry may be considered boring in some artistic circles. I won't argue with that. But when it comes to health, this is the best thing we have going for us. So in other words, when you're looking at this particular image, take a look at this, hot, versus this, cooler, or probably not necessarily cold, but normal, whereas this is definitely abnormal, okay? What's also important is what I call delta T. Delta T is simple explanation for delta is the difference between 2 points of reference. In other words, if this particular spot, or it's quite a big spot here, versus the opposite side, if it exceeds 1 degree or 1.5 degree, or in this particular case, it probably exceeds like 5 degrees, then it's considered to be above normal limits. And therefore, we can surmise that either this is a dental pathology, or maybe affecting the sinus issues as well, very common. Or, as a matter of fact, it could be something topical. This person could have a big kind of something inflamed skin in front of them. So this is something to keep in mind as well, okay? So identifying potential health issues. So we have several very important things. Number one, inflammation, okay? Inflammation is the root of all evil. Nerve problems, vascular changes. And finally, last but not least, definitely muscular injury. Now, they could also be intertwined. It doesn't have to be one versus the other. It could be a combination of things. Let's look at this, because obviously we also have limitations in thermography. And therefore, let me take a look at let me just rephrase this. It's not about absolute temperatures, that would be too simple. But it's all about the differences and patterns. So what's the limitation of thermography? Thermography is not a standalone diagnostic tool, because just like I explained this to you before, just the previous image, you will naturally see that most likely it is a dental pathology affecting their sinus, but it also could be a topical thing with their skin as well. So it should be used in conjunction with other tests and clinical information. And that's why when we're looking at images that are being sent to us, we insist on, please give us as much information as possible, patient history, their pathology, other tests if possible, their symptoms, if any. That gives us kind of a better understanding of what's going on. Maybe we can eliminate a few other things. Naturally, a person who sent that image to us, if he or she would tell us that this person has a topical skin condition, then okay, that I understand why we have a big red blotch, taking up probably half of the face. But other than that, if they don't see it, most likely it's not present there. So most likely it's going to be something beneath the surface. So applications in thermography in your practice. We will talk about breast health. This is something that I think our next webinar next month is going to be focusing on. I'll give you some examples, but we're not going to go into a lot of detail. We'll also be talking about vascular health. It's becoming more and more prevalent. Musculoskeletal issues, dental and maxillofacial issues, and others. And I'm going to leave kind of others kind of to explore with you, because there's so many different applications of thermography that hopefully you will kind of just get a glimpse. So let's start with breast health, because I spent a lot of my time and many years, dealing with this. And naturally, I found this very kind of rewarding, because it's such a huge issue. Not to plug my book, but I truly believe that breast cancer is a preventable disease. Unfortunately, most of the women, and I hate to say this, even most of the conventional practitioners have missed the boat when it comes to prevention of breast cancer. So thermography detects variations in the temperature of breast tissue, right? Usual heat patterns may be indicative, or sorry, I should say unusual heat patterns may be indicative of inflammation, increased blood flow, or other anomalies. So what are the benefits? Number one, risk assessment. I use risk assessment. I don't use the term early detection, because thermography does not detect breast anomalies or abnormalities. Thermography may give us a risk assessment, and I'll explain a little later exactly what I mean by that and how we use that. It also can be used in terms of monitoring and risk stratification. So let me kind of unpack this with each one. First of all, let's look at risk assessment. So as I said, abnormal patterns, asymmetry, could be kind of indicative of certain issues, and they may be palpable or may not be palpable, and they may be visible or may not be visible with mammograms, ultrasounds, and anything else. Because thermography is very specific, and it's not to say that thermography replaces any of these modalities, not at all. They all have their kind of place under the sun. So, do you see the difference? Can you see the difference? So what's why I want to particularly bring your attention to this particular area. And what you're seeing here, first of all, is nipple that is going to be significantly warmer than the opposite side. We have supra and subareolar areas that are significantly warmer than the opposite side. And then we have the vascular development in the kind of upper medial portion of the breast as well, which again is not seen on the opposite side. So the difference is quite apparent. And as I said, in this particular case, it may or may not show up on other tests. But when we see something like this is a high risk situation here. And definitely we're going to be a little bit more aggressive with this patient, even if they come back and say, well, my mammography comes back normal, and there's no evidence of everything else, great. But what I want to point out to all of you is that in this particular case, thermography could be very predictive, because they may develop, and most likely there is a high probability that they will develop this disease within the next couple of years. So treatment monitoring. For patients who have had breast surgery or treatment, thermography might provide prognostic information about healing, inflammation, or recurrence. So any kind of sudden changes, once we have a baseline, then everything is going to be compared to that baseline. So the subsequent kind of thermal images sometimes are even more important than the initial or baseline images. Sometimes we may deal with any kind of deviation will suggest potential recurrence or complications. Here we have a very good example. Actually, it's a positive example of 6 months of indole-3 carbonyl supplementation. It's a over-the-counter thing. I3C is made from cruciferous vegetables. If a person is kind of prone to estrogen dominance, I3C or DIM or many other things could definitely help in this particular case. And you can really see the difference. Of course, it's an exaggerated case, and that's why I'm presenting this. It's not that subtle. You can see on this side, you can really see a lot of inflammation, a lot of activity. And the more activity we have, the more likely the probability of something is going to happen. We want to see something like this. As I said, it's truly miraculous where you, give someone a $20, $25 a month over-the-counter phytoceutical, and it really reduces their risk of developing breast disease or even cancer by a great deal. So keep one thing in mind, it doesn't have to be going this way. I'm not talking about I3C supplementation. Sometimes this is our baseline, and then 6 months later or a year later, we can see something like this. Wow, we're definitely not moving in the right direction here. When I talk about risk stratification, basically what I'm suggesting is that abnormal thermographic patterns will correlate with an increased risk of breast cancer. We use a particular interpretation guidelines that have been set by the international kind of community, and we specifically use kind of TH1 to TH5. TH stands for thermal. This is based on statistical probability of risk. And that's not to say that TH1 lowest risk has no risk. Risk is always present, but statistically, it's very, very low. Just like, let's say, if we're getting into TH4 or TH5 category, malignancy may not be present, and hopefully it will never be. But statistically, the probability between now and the next 3 or 5 years is very, very high. So thermography can offer this value of identifying individuals who are at higher risk. And if you're at higher risk, by all means, make sure that, number one, you sit down with someone and figure out what's causing that higher risk. Maybe you can alleviate some issues. Maybe it's hormonal, maybe it's the lifestyle, maybe it's stress-related issues, maybe it's your diet, you name it. There are many different things that will affect this person, and try and slowly kind of work them back, for, let's say, from TH4 to TH3 to TH2 and so on. But also, if you are at the, let's say, high TH3 or TH4 and so forth, by all means, I want you to have a more intensive screening. So many people think that for some reason we're against mammograms, or we don't like conventional or structural tests. I'm all for it, especially once we've identified someone who's at high risk based on thermal imaging. Okay, so that's very, very important concept also to have, because when a woman goes and gets a mammogram and comes back negative, okay, great. But does it mean that there's nothing that's going on? Because we all know that breast cancer does not develop overnight. We all know that it may take up to a decade until it becomes detectable by mammography. So if she's in year 5 and her mammography result comes back negative, does that mean, okay, go home and continue doing whatever it is you're doing, and you have no idea whether you're at high risk or not? And that's the kind of the benefit of thermography that can bring to not just to patients themselves, but to the practitioners as well. This is something that I'd like kind of to present as well, because as you can see, there is a blind spot. What I call a blind spot, as you can see, these are my old images from 2007 and 2010, but things like that happen every year. Let me kind of give you a little bit of history here. On your left, we can see that more or less everything is fairly symmetrical, not a big deal. The nipple temperature is a little bit on the warm side, but still within 1 degree Celsius. There's a bit of an asymmetry in and around this area here, but overall, not too much of a concern. Maybe just a few question marks here. But then this patient comes back 3 years later, and all of a sudden their delta T, you remember that delta T? Well, delta T for the nipple is over 2 degrees Celsius, and for the perioreolar area is over 3 degrees Celsius. And guess what? Look at all this development from here to here. Now, subsequently, we know that she had developed kind of breast disease, but the only thing she was doing, she was taking bioidentical progesterone cream. And by all means, don't get me wrong, I'm all for bioidentical hormones. I'm against synthetic. In this particular case, it didn't work for her. And if you just look at her blood results are not going to show you anything, because breast tissue will metabolize hormones on their own. And maybe she aromatizes her progesterone into estrogen. I don't know. Maybe she's drinking too much coffee. Maybe she is drinking 3 bottles of wine a day. Obviously she may be doing something, but just by looking at their blood results, it doesn't really give you full information. It doesn't happen all the time, by the way. It's in a small minority of cases, but as I said, in a small minority of cases, we do see that even good things like progesterone cream may not be suitable for this particular patient, because, as I said, she may be aromatizing it into estrogens. That's why I call it a blind spot. Vascular health. Let's take a look at vascular health. Again, it's quite obvious something is going on here, right? Versus this one. So you're looking at different volume, different speed of the blood flow. You're looking at sometimes regions of reduced temperatures, or thinking of things like peripheral arterial disease. So we want to monitor that treatment, whatever treatment is prescribed here, and then bring this person back in 6 months or a year, whatever it takes. Take a look at the baseline, which is this one, and see, is your treatment effective? Are they getting better? Are they getting worse? How do we know? Well, naturally, if they're getting better, probably they're not going to have any symptoms, but this could be an asymptomatic issue as well. So when it comes to musculoskeletal issues, detecting inflammation, as I said, inflammatory conditions, arthritis, tendonitis, will present with increased heat. And then obviously they're going to be visible with thermographic images. Sprains, strains, injuries to muscles, ligaments, again, will show on thermal patterns. And finally, as I mentioned before, it could be used as a guide to their physical or any other kind of therapy, because if they're moving in the right direction, obviously we can track that and we can see that. So there are other applications of clinical thermography. If you're looking at this particular picture in your top left, we're looking at hands. We're consistent with the carpal tunnel syndrome. If you're looking at the one top middle, the third digit, no, it's not a root sign. It's just simply a presence of inflammation. Here we're looking at cooling over the area of the lung. So we will investigate, is this organ stressed? Is something is going on? In this particular case, bottom left, we're looking at ring around the collar, which is present, very common in women with hypothyroid, under active thyroid. And we also see that there may be kind of issues with appearance of sinus irritation. Here we have plantar fasciitis. Here we have, it's a faint kind of V sign. And years ago, it was established that when it comes to things like fibromyalgia, for some reason, we don't see a lot of fibromyalgia lately, at least in the clinical practice. But 20 years ago, we've seen a lot of fibromyalgia. Now, in my opinion, fibromyalgia has been grossly misdiagnosed. But if you see that V sign, as you can see it here, sometimes it's even more prominent, then most likely it is fibromyalgia. If you don't, it's misdiagnosed something else. Look for other issues that that will point you in the right direction of treatment. Dental and maxillofacial. I spent the last, I would say, 15, maybe more years exploring this issue. I even published a paper in the European Journal of Ophthalmology, because we did a study, and what I came to realize after that is that in the majority of cases, thermography will pick up kind of an early warning signal where the patients are still asymptomatic. Now, TMJ disorders, so huge, and temporomandibular joint disorders may present with inflammation, but so many people are suffering with headaches, and actually the etiology may be TMJ disorders. Then we have dental infections, abscess, root canals, all sorts of things. And let me ask all of you, because maybe some of you already know what I'm going to ask. When was the last time family doctor inquired about the patient's dental health? Usually, it's never, right? We've decapitated, to the patient's detriment, people from above the neck and people to below the neck. And unfortunately, this is a huge area. It's a huge gap, no pun intended, that a lot of practitioners are simply missing. Again, we will specifically talk about this not next month, but I believe 2 months from now. So anyone who's interested in this is such a fascinating field that really hasn't been explored. And finally, sinus infections and sinus issues are also can be seen. What's missing here is also, I just realized after I prepared these slides, is migraines and headaches. Okay, again, as I mentioned before, some of them may be caused by TMJ, but some of them are caused maybe by something else. But in many cases, especially when it comes to migraines, there are particular patterns that correlate to their history. Let me give you a very quick kind of rundown of what you're looking at. I actually just copied from one of our reports. Here's an image. And you can see how one-sided everything is on the right side of this patient. And by the way, most likely this patient is going to be suffering from severe migraines with heat like that. But look at this. There is most likely, again, dental issues, sinus issues, probably a nodule on the thyroid. The whole right side of the neck is, we need to explore this. Not only that, it also kind of drifts through lymphatics into her breast. Her shoulder is affected. This is definitely, we can look at a bit of kind of a snapshot when it comes to her neck, and finally a little bit more detail when it comes to upper and lower jaw on the right side. Definitely we need a physical examination with a dentist here. So remember, I told you about others. Thermal imaging has wide-ranging applications. So nerve issues, nerve impingements, neuropathies. And by the way, neuropathies are so common and so difficult to treat because they're kind of difficult to identify. Digestive disorders, again, probably half of the people out there have one or another kind of a digestive disorder. Things like Crohn's disease obviously are going to be presenting with a lot of inflammation. And finally, skin conditions. As I mentioned, Raynaud's. We can have things like even skin malignancies will most likely present with heat as well. So other applications, just to give you an idea, once again, we're looking at sinus infection here. We're looking at this intestinal dysfunction in and around here. So when I see something like this, I always ask, how regular are your bowel movements? Here is the fibromyalgia pattern. And here, dental pathology definitely there. Years ago, someone put me up to it, and I started looking at women who come to us who already have been mastectomized. So just out of curiosity, I would say, can I take a picture of your face? They'd probably look at me like I'm weird. But I had a particular purpose, and I've identified that in great majority of women who have had mastectomy on the same side, we're going to have dental pathology. So it's very unlikely that breast cancer or mastectomy created that dental pathology. Most likely, it's the other way around. And I'm not suggesting that dental pathology will create breast cancer, but what I'm suggesting is that, you know, it kind of predisposes, or in a sense, kind of opens this up to other issues and other pathologies. In this particular case, the breast. With Chinese medicine, you know, it's quite accepted, and many other forms of alternative medicines, there is definitely a connection. There's definitely a connection between dental pathology and a cardiovascular disease, and I truly believe that there is a connection between dental pathology and malignancies as well. So, benefits to incorporate thermography into your diagnostic toolkit. Well, I think it's quite obvious. There is no contact, it's pain-free, and I think every holistic practitioner, not even holistic practitioners, we all kind of want to make sure that we don't injure our patients. There's definitely early detection, even before symptoms may set in. There's a comprehensive view. It complements other modalities. It's not exclusive, it is inclusive. And as I mentioned before, it creates that patient comfort and safety. So I think, you know, we have enough reasons there alone. But in summary, I just wanted to come to an end of this presentation, and I hope that I've given you a few kind of bits here and there to whet your appetite. You know, by all means, come back next month and the month after that. I find it kind of personally satisfying when I teach about thermography. As you can see, I'm a little kind of excited about this. I have been for quite a while. I wish the rest of the world kind of accept obvious what we see now. But as far as the Canadian Association of Clinical Thermography, our goal is really to establish thermography as a tool in healthcare, both for individuals and for professionals. And we want to make sure that everyone has access to this equipment and everyone has access to tools to enhance patient care and quality. And everything comes to education. So to me, and I hope I've given you a little bit of a glimpse into thermography really is a transformative potential. And I think that it's a groundbreaking technology that hasn't been recognized yet. I'm pretty sure that it will be, hopefully in my lifetime. And as I said, I want to kind of thank you all. If you have any queries, if you have any additional details, if you want to connect with us, if you want to suggest topics or things of interest, please contact us at connect@thermographycanada.com, or you can call the number here. And finally, with a few minutes left, we'll go into a Q&A session. As Tali mentioned before, I'd like to invite your questions. Please do your Q&A. Tali will kind of mention them to me, and hopefully I'll have an answer for you if you have anything pressing. And if not, by all means, you know, if you're not sure what you want to ask or formulate, by all means, you can certainly email to us as well. Okay, Tali, do we have
so much.
any questions?
Yes, but before we do that, I just wanted, Catherine, can you just pop in for a moment? Catherine just has a quick announcement about the future sessions, and then we'll get into the questions. And people, you can start typing in questions if you haven't yet, and I'll get to the ones that are already there.
Perfect. Thank you so much, Tally. Thank you again, Dr. Mostovoy. Always fantastic learning from you. All right, so our next upcoming, we told you that this is going to be a monthly ongoing thing. So the next session is going to be Wednesday, October 25th, same time, 12 o'clock Eastern, 1 o'clock Atlantic Standard Time. The topic is thermography and breast health. So integrating non-invasive assessments for breast health. You don't want to miss that. The next one after that, November 22nd, again on a Wednesday, it is going to be all about thyroid and dental care and how we utilize the non-invasive imaging for thyroid and oral health assessments. December care. All right, so again for you as well, the next topics, and we will review those as well. So again, Tally will also send out to everyone who is registered. We'll send out the webinar links, and of course, we'll send that out through social media to make sure we're reaching as many people as possible. But again, the next one is all about breast health. You don't want to miss that one. Thank you so much, Tally.
Great. Okay. So we have a question here that's more of a technical question, and that is, what is the best camera for in 2023?
It's an interesting question that I've been asked many, many times. The cameras, most of the cameras that you see on the market are fairly usable for thermography. It's not the camera, it's the software. And even more than the software and the camera, it's who is taking the images, what type of qualifications and training this technician has, whether or not they're following proper thermography kind of conditions when it comes to setting in the lab, whether the they're using temperature that's allowing patient acclimation, whether or not they're using cold water challenge and things like that. And then the next step is who is interpreting these images, what's their background, how long have they been doing this, what's their training, and so on and so forth. So it's not a camera issue, it's not hardware, it's software, right? And I mean software more like who's taking the images and who is interpreting. But if you have something specific that you want to email to us, comparing one camera to another, if that's exactly or specifically the only thing that you're looking at, just email to us and I'll try and answer that as much as I can.
Great. And then how can practitioners access thermography to be used in their practice?
Well, it depends where you are. We have kind of associated testing centers, or we like to call them clinics. They're completely independent. Depending on where you are, you can email to us and we can connect you with a properly trained thermographic technician or a clinic there where they can come and image with you, or you can kind of collaborate with them depending on kind of your needs and requirements. So again, if you could email to us a little bit more specific where you are, we can definitely connect you with some of our colleagues. In case of, let's say, Catherine, who is in the Maritimes, in New Brunswick, in Nova Scotia, in Newfoundland, I think PEI as well. Never forget PEI. If you're somewhere close, please contact her directly, and I'm sure you can kind of get what you need.
Great. And how can ENTs use this technology to support them?
Great question. I think not next, but following, we're going to be talking orofacial. issues. So again, if we're talking about sinus infections, if we're talking about maybe dental that's affecting sinus, that's where thermography comes in. So 2 months from now, we'll be specifically talking about that area in general. But you know, again, it all depends on, you know, ENT. If you want to email me or email us kind of specific questions, I'll be happy to answer them.
Excellent. Okay, so that's all the questions that I have in here. Again, that's November 22nd is the dental and thyroid topic coming up. So for those of you want to take note of that. And October 25th is the next one. So you can make a note in your calendars for that. Just a second.
And I think we'll be sending invitations to you, the participants. Will be also sending invitations to other people. So please stay connected.
There's a question that just came in. Sorry, aside from the actual thermography images and report, is it possible to also include a preliminary treatment plan on how to improve the results with other treatment modalities? So
I try and stay away from that because you know, as I said, I truly believe in kind of individual medicine that's geared towards the individual. Just to kind of give a blank statement, it depends, right? So it depends on the subject. So let's say if we're looking at breast health, yeah, I can give you kind of a general idea, but would it apply to you or would it apply to your patients? I'm not sure. So that's why I try and stay away from that and deal through practitioners. So if somebody's a naturopath or a chiropractor or whatever modality you're practicing, you are probably better suited to give kind of more specific advice rather than kind of general information.
great. Excellent. All right, everybody. Thank you so much. This has been wonderful. We did go a little over the hour, but obviously there was a lot of interest. So thank you for that. And we do look forward to seeing you all at next month's webinar. And please invite other practitioners that you know to join in.
Thank you all. All the best.